Diabetes Connections is brought to you by One Touch. Every touch is a step forward. By Dexcom. Take control of your diabetes and live life to the fullest with Dexcom. And by No Foods, no grain, no gluten, no guilt.
This is Diabetes Connections with Stacey Sims.
This week, a bonus episode. This is a tough one, but an important interview. I hope you'll listen to the whole thing. You probably have heard about Alec Smith, a young man who died last year after he couldn't afford insulin. Well, you're going to hear from Alec's mother, Nicole, and she's going to tell us the whole story about how this could happen. This is a story about the price of insulin, healthcare in America, and about a young man trying to be independent. There's a lot to unpack here, and Nicole is gracious enough to take us through the entire story. She is hoping to educate others so that this doesn't happen again, and not just on the personal level, so that this doesn't happen again because it can't, because she's trying to affect policy on the state level about getting emergency affordable insulin, and she's trying to affect policy on the national level where there could be more transparency when it comes to the insulin makers. And the reason that I'm putting this episode out now, and as you're listening, this is the last week of September of 2018, is because there is a protest planned this weekend at Eli Lilly headquarters. Now, if you're listening later on, don't stop listening. This is a story that is a cautionary tale in a lot of ways, and I think we can still learn from it, and I certainly don't expect this issue about the pricing of insulin to go away after the protest this weekend. But it's very timely right now, and I do think we're at a tipping point in terms of healthcare in our country. I'm going to link up more information from T1 International, the people behind the in-person protest that's going on in Indianapolis at Lilly headquarters. But there's a lot you can do if you can't be at that protest, and you can learn more about T1 International going to their website through ours. I will link it up, as I said, in the show notes. I'm also going to link up a few of the national stories that have already been done on Alec Smith and Nicole Smith Holdt. Probably the best well-known of those was on NPR. They did a very long story about the high cost of insulin and the rationing. But in recent days, network TV stations have done similar stories. If you haven't heard this story, you're probably thinking, how could this happen? It could never happen to us, right? But if you have heard it, you already know how quickly this all happened, and how when Nicole takes us through, it becomes clear how it really could happen to any of us if things don't change. Here's my interview with Nicole Smith Holdt. Nicole, thank you very much for joining me. A lot to talk about here, and I appreciate you giving me some of your time. Thank you.
Well, thank you.
You know, it's had to have been a very difficult and long year. Many people in our community are familiar with the story, and we will go through what happened. When we look at this issue, many of us within the community who have insurance don't realize the cost. We just go ahead, we fill the prescription, we're happy to have the insurance that we have. Is that what happened to you? I know that Alec was on your insurance for a long time. He had turned 26 just last May. But were you aware of the cost before this happened?
No. You know, when he was first diagnosed back in 2015, his first trip to the pharmacy, when he had to pick up all of his initial, supplies and his meter and test strips and his insulin, he came home and he's like, holy crap, Mom, you're not going to believe how much I just spent at the pharmacy. And I was like, well, I bet you it's just because it was your first time and we haven't, dipped into the deductible or anything. I think it'll get better. And at that time, I think it was maybe $400 or $500 out of pocket that initial time. And I'm like, let's wait and see what happens next month. Month 2 came, and it was like $275 out of pocket with the insurance. And I'm like, well, that's better, but that's still quite a lot. And the first, because I'd already been in the middle of my insurance year, I couldn't make any changes to my insurance or anything like that. And we're a pretty healthy family, so we never worried about, having that deductible or having to pay co-pays or anything like that. We went to the doctor annually, we did what we needed to do, and that was about it. But the following year, when my insurance came up for renewal, I thought, well, I wonder if there's anything I can do to help him with, these monthly expenses at the pharmacy. So I decided to opt into the healthcare savings account program that we have at work. So I was getting some money taken out of my paycheck every 2 weeks to put into an account where he could use a benefit card at the pharmacy to help with his co-pays and his deductible. And so that helped him a lot, the second year. But then when we started going into the third year, I was like, well, I'm not going to do that this year because you're only going to be on my insurance for 5 months. At 6 months, you're not going to be on my insurance anymore. The rest of us don't need this, so I'm not going to participate in the healthcare savings account. And, we knew that he was going to be looking at some pretty high out-of-pocket expenses, but we just had no idea it was going to be as expensive as it was.
Okay, so let's back up a little bit. Alec was diagnosed at 23. So he was already a young adult, but still young enough to stay on your health insurance, which you can stay on up to the age of 26. Can you take us back through his diagnosis? How did he find out?
So he had started feeling really quite ill, like he was coming down with the flu or, some sort of virus that was just kind of kicking his butt, and he couldn't shake it. For like a week, he kept complaining of just feeling really ill, like just not himself, feeling sick, like lethargic, and having an appetite at one point, and then feeling like he couldn't eat anything, always feeling thirsty. The night before he actually went into urgent care, he said that he was up most of the night, frequently going to the bathroom, feeling lightheaded, feeling nauseous, feeling shaky, feeling like he had muscle cramps. So when he called me that morning that he went in and explained what his symptoms were, I was like, I feel like you're dehydrated. I feel like, something is going on. This is lasting too long. You really need to get in. And so when he went in and he went into urgent care and he told them his symptoms, luckily right away, the first thing they thought of was diabetes. And so they had done their test, and his blood sugars were like 459. And so they hooked him up to some saline because he was really, really dehydrated. And with the high blood sugars, I don't know how he drove himself to the doctor, but he did. They kept him there for a couple hours, monitored him, gave him a bunch of insulin, did a quick diabetes education, gave him a bunch of prescriptions. And once his blood sugars came down under 300, they released him. And he had called me from the clinic, and he was like, this is what they're telling me I have. And I was like, are you serious? At that time, what I knew about diabetes was they said type 1. I'm like, that's juvenile diabetes. You're not a juvenile anymore. And he was like, yeah. So I did a quick computer search and found out that, you don't have to be a juvenile to be diagnosed with type 1 diabetes, that more and more adults are, getting a late diagnosis of it. He came home and he was, we went through all the paperwork, looked at, the diet changes that he needed to make, looked at, the lifestyle changes that he needs to make. He made up all of his appointments with the dietitian and the endocrinologist, and he seemed to really accept it well and was like, this is what I'm stuck with. This is what I'm going to have to deal with. This is what I'm going to have to live with for the rest of my life. I'm going to have to take this seriously. And he did. He went through and he completely changed his diet. He became more diligent on, counting his carbs and taking his insulin.
What's that like? I mean, I had such a different experience. Obviously, my son is so tiny when he was diagnosed. What was it like to have your young adult son going through that? I mean, did he want your help? I know that you had a close relationship, but was the family involved, or was it more like, I got this?
Early on, he was like, can you help me? I don't know, he had never really done grocery shopping for himself. He still lived at home. So we kind of went through, what it would be, healthy options, lower carb options, how to take things, more seriously. Instead of eating a whole pizza, let's go down to maybe a salad and like 2 pieces of pizza, which was really hard for him because he lived on tacos and pizza and beer and, pop. And
pretty typical.
And now he needed to switch to water and other types of things. So he did want my help at the beginning, but then I think towards year 2, closer to, being a diabetic for about a year, he was just, I think he had taken enough of my assistance and was like, Mom, I got this, because I would ask him all the time. I'm like, what are your sugars like? What are you eating? Blah, blah, blah. He's like, okay, stop nagging. I'm doing okay.
Just like all of us
it's not nagging. I'm helping.
Right,
it's just helping.
Right. So fast forward a bit, though. He then was on your insurance, as you mentioned earlier. He had to come off of your insurance when he turned 26. Now, he was working, but he didn't have insurance at work?
Yeah. Right. So he was a manager of a restaurant. Well, it was a new position at that restaurant. Prior to him becoming the manager, he had worked there for about 5 years as a server, host, bartender. And it's a small family-owned restaurant. They only have 3 locations. And in the state of Minnesota, if you have under a certain number of employees that are full-time, they don't have to legally offer insurance. In December of 2016, he finally took the promotion that they had been offering him for several months. I think he felt like, taking the promotion and getting a pay raise, going to a salary position with guaranteed hours, a guaranteed paycheck was going to be easier for him to handle the cost of his diabetes versus living on tips and stuff like that. He wanted that security. I know I had talked to him several times. It was like, you have to get into a position that offers benefits. You need to have insurance when you have diabetes. And he was like, well, I'm thinking if they open up another restaurant, they're going to have enough employees that, they'd have to offer us insurance. And I'm like, who knows how long it's going to take them to open up that 4th restaurant. You can't bank on that. So in February of 2017, when I knew we were approaching his birthday in May, I started playing around on the computer with the Affordable Care Act and any kind of medical assistance programs the state of Minnesota might offer. And unfortunately, with his increase in his salary, he didn't qualify for the MNsure program, or, he wasn't considered disabled, so he didn't qualify for disability. The Affordable Care Act, he made too much money for that. So what we were left with was shopping the marketplace. And unfortunately, the marketplace doesn't have, great policies. What we were looking at, where he could keep his same endocrinologist and stay within the same healthcare system, would have cost him $450 a month with a $7,600 deductible, wow. Which meant he would have been paying for everything out of pocket, including the monthly premium, for a good 6 months. And that just didn't seem realistic.
Okay, so just to translate, because I think most people are familiar with what you said, but that would be a monthly payment to the insurance, out of pocket, $450 a month, and then you pay everything up to $7,500. Once you pay that, then the insurance covers it. So just to kind of make it clear, I think a lot of the words go by and most people understand, but at the same time, when you think about it like that, it is so much money.
Oh, yeah, especially when you're looking at, the average diabetic out-of-pocket spends between $1,000 and $2,000 a month on their insulin and supplies if they don't have insurance, plus that $450 insurance premium. That would have been 80 to 85% of his monthly income just paying his medication supplies and insurance. So it would have left him very little to afford his rent and car insurance and gas and groceries and all the other bills that everybody else has to pay every month. So he decided that because it was going to be so expensive that he would just pay out of pocket, skip that $450 a month insurance premium, bite the bullet, go to the pharmacy and pay what he had to pay until he could get a new job, get something with benefits. So on June 1st was the first month without insurance. He had done his refill for his insulin and supplies at the end of May. So towards the end of June, it was like June 21st or 22nd, was the first time that he went to the pharmacy to pick up his insulin and needles and test strips and all of that. The pharmacist told him that his bill was $1,300, and he didn't have $1,300 in the bank. He knew he had a little bit of insulin left at home, so he figured that he could maybe change his diet a little bit, is what we're guessing because of what I saw in his refrigerator and stuff when we had to clean out of his apartment. When his body was found on June 27th, every single pen that he had in his apartment was kind of scattered around and completely empty. He had not a drop of insulin left in his apartment. His refrigerator was full of low-carb foods, vegetables, fresh vegetables, fish, chicken, eggs. I think anything that was not going to spike his or increase his need for insulin he was eating. I know his girlfriend had seen him on Sunday, which was 2 days before he was found, and he was not looking good. She was concerned. He just said that he was really tired, not feeling well. He was out with some friends on Saturday night because one of his friends was moving to Texas, so they were having a going-away party for him. So she thought maybe he was just feeling a little hungover or just coming down with something. But she noticed that he had difficulty staying awake. He was complaining of abdominal pains. She wanted to go to a food truck festival, and he just said to her straight out, he's like, I don't have enough insulin to eat that kind of food. I can't go to the food truck festival. So, she didn't think anything, was odd about that. So they went to like a little bistro for dinner, and apparently he couldn't even eat his food. His stomach hurt so bad, and he was complaining of, like a shortness of breath. So she figured that he was coming down with like a respiratory something or just, wasn't feeling well. And so she had left him that night, and that was the last time anybody saw him. On Monday morning, he called into work and said that he did not feel like he could safely drive, that he was vomiting, severe abdominal pains, and was having shortness of breath, having a hard time breathing. That was the last phone call that he made to anybody. He was found on Monday when his girlfriend was checking in on him because she had been calling him all day on Monday, all day on Tuesday. And I had sent him a text message on Tuesday letting him know that I was coming that evening to drop off something for him. And I didn't hear anything. He didn't text back. About 5 minutes after I sent that text to him letting him know that I was coming over that night was when I actually got the phone call that he had been found.
I'm so sorry to take you through all of this again, and I do appreciate you sharing this story to help others. When did you all find out, and how did you find out what had happened, that it wasn't, an accident, it wasn't something that, he wasn't taking care of himself or things like that people say?
Mm-hmm. When his girlfriend had gone to his apartment that evening when she couldn't get a hold of him by phone, which is unusual. When she went to his apartment, she saw his car there. He wasn't answering his door, and he wasn't answering his phone, so she knew something was wrong. That's just not typical behavior for Alec. She was able, because he lived on the ground level of the apartment, she was able to open up one of his windows and climb into his apartment, and she's the one that actually found him and started making phone calls and calling 911 and calling family. And as soon as I got there and I tried to go into his apartment, the police wouldn't let me in. And I asked them, I'm like, what is it like in there? Your first thought is he hurt? Did somebody hurt him, or did he hurt himself? And they were like, no, nothing like that. The medical examiner had come, and I had explained that, he was a type 1 diabetic, and his first impression from the scene was that he had no insulin. So he felt strongly that it was related to the diabetes. And my heart just sank.
I guess what
I couldn't understand it.
Yeah. So you were describing earlier how you found the insulin pens emptied. You found low-carb foods. When did you all really figure out that this was all about rationing insulin?
Yeah. Speaking with his girlfriend, just sitting down and trying to put a timeline together, finding the receipts in his car from the last time that he had picked up insulin and realizing when his refill was due, looking at when you get your prescription, they usually have like how much you owe and what it would have cost without your insurance, or what the list price is, and just kind of looking at his bank account and looking at the expense, and looking at when he went to the pharmacy. It was like putting a puzzle together and kind of recreating those last few days for Alec.
You said earlier that you have a pretty healthy family. You'd never really used the HSA or the healthcare savings account on your health insurance. Was one of your first thoughts had to have been, or at least I'm trying to put myself in those shoes, like, how could this possibly happen?
Mm-hmm. I think to myself on a daily basis that this should not be happening to anybody. Nobody in the United States should be struggling to afford health care or their prescription medications, especially medications that are not optional, that are life-saving, that is the only thing created to keep somebody like a type 1 diabetic alive. That pharmaceutical companies should not be profiting from this diagnosis, from people having to use insulin to stay alive. It's extremely frustrating. Here we are in 2018, living in the United States, what people consider one of the wealthiest countries in the world, and you read about people who struggle, who go into debt, who are in their 40s or 50s having to move back home with their parents because they can't afford rent and their diabetes supplies and insulin. Or you read about, people who are using expired insulin that they've traded or received from somebody on a Facebook black market. Or you hear about families that are sharing insulin because they can't afford to have more than one diabetic in the household. It's heartbreaking. It's something that should not be occurring, especially when you look at the United States and then you look at, a country that we consider to be a third world country, places like Mexico or places, in the Middle East or, places in countries of Africa that they're receiving free or a very reduced, affordable price for their insulin. It's so frustrating. It feels like pharma is doing this intentionally because they know that you don't have an option. You pay for this or you die. So they feel like they can charge whatever they want, and you either pay for it or you die. It's frustrating.
What about people who say, and I've seen this on social media and we've done shows on it before, well, there's old formula insulin at Walmart for $25. Why didn't you just go get that? Yeah.
So, there is a lot of talk about the Walmart insulin, and I did talk about that 2 weeks ago when I was in D.C. and, sat at a hearing for prescription drug pricing. Most people do know that there is, the Walmart insulin for $25, but it is an old insulin. It's hard to manage. Most endocrinologists don't even know where to begin to assist you with it. There's no regulations over it, so you don't know how much insulin that you're supposed to take, because it doesn't work the same way as the fast-acting or the long-acting
right, it's a different formulation.
Insulin. It's old. There's a lot of fillers in it. The insulin is not a great quality. It doesn't react in your body the same way. It's very difficult to manage. Somebody who has a busy lifestyle like Alec, who worked, as a manager, would work crazy hours, would not a consistent lifestyle. It would have been very difficult for him to manage it and still be a functioning employee. It's very regimented. You have to take it at a specific time every day. You have to take the same amount. You have to eat the same things every day at the same time every day, and hope that your body accepts it. Not every diabetic can use that type of insulin. It was not recommended that Alec use it. I know he had spoke to his endocrinologist about it, explaining that he was going to be without insurance, and they did not recommend that it would be an appropriate option for him because of his lifestyle. I know that it ends up causing diabetics to have really high highs and really low lows. So then again, you're using a lot more test strips, which those are really expensive as well. So it's like you're trading, one expense for the other for some people. In a life or death situation, I absolutely would recommend, using it to save your life, but I wouldn't recommend somebody using it to maintain their life.
You're in Minnesota, and I know you've spoken to legislators there trying to get some things done. What are you pushing for in Minnesota?
Yeah, right now we are working with Representative Erin Murphy. She last year had, I don't think it was even last year, it was this year. She had introduced a bill. It's called the Alec Smith Emergency Insulin Act. It didn't pass the first time it was introduced, and so we're hoping that with enough voices and enough push, we can get that pushed through for the next legislative session. But it would provide free or on a sliding fee scale insulin supplies for a diabetic in an emergency type situation, like, they lost their job or they just aged off of their insurance, or they're new to the state of Minnesota and they don't have time to get signed up for public assistance or whatever. The state would buy the insulin and supplies at a bulk rate and would be able to administer it to a type 1 diabetic. Well, it would be sent to a pharmacy or sent to a clinic where they would, go through the intake process to make sure the person qualifies for free or sliding fee assistance while they get back on their feet.
Is there resistance to that? Are people pushing back? Have you heard from the drug companies saying, we don't want this?
No, we haven't really heard anything like that. I'm hoping, my husband is part of the SEIU healthcare union, so we've got the backing of that union. I'm part of the MAPE program, or MAPE union in Minnesota, and I've got the backing of them, and we've got it feels like a lot of support in Minnesota, so we're hoping that, the next session we can get this pushed through. I think both of our unions are really going to start campaigning hard for this. I think the last time that it was introduced, there wasn't a whole lot of time for us to prepare to really push for it. So I think this time, given it, we're going to start early and we're going to push hard.
So at last year's protest, there was a protest in front of Lilly headquarters, in front of Eli Lilly headquarters, and I know they read a statement from you about this. Have you talked to the people at Eli Lilly or any of the insulin companies?
Yep. So back in May, I was in Indianapolis. I did a press conference in front of Eli Lilly, and I was invited to attend their quarterly shareholder meeting. So I went to the shareholder meeting, and then I was invited to have a meeting with the Vice President, Mike Mason. So I sat down with Mike Mason and shared Alec's story and shared a picture of Alec and, shared with him what my thoughts were on the insulin crisis and, threw out a few ideas of ways that they could help with this situation. And at the time, Mike Mason seemed to, be empathetic, and, he appeared to really listen to my story and acknowledge that there is issues surrounding the affordability of insulin. I think that they are kind of they don't really see the whole issue. I think they are misguided in ways, and they feel like some of their approaches to the affordability issue are the answers. I think that they tend to, their usual response is that the pricing issue is complicated, it's complex, and they like to pass the buck onto pharmacy benefit managers and insurance companies and physicians and hospitals. And a lot of times I feel like they don't own their portion of the problem. The list price is too high. Let's start there. And most people do acknowledge that, having all of these middlemen within the whole chain of supply causes the price to go up. But I think that, if they can start on their end with the list price, we might notice a decrease. Yeah. There is a huge problem with the pharmacy benefit managers and the insurance companies. But I think, to start making an impact in the lives of type 1 diabetics, and we have to absolutely have transparency. We need to know, how much it actually costs to create a vial of insulin.
Yes.
Rumor is it's less than $1, but yet they sell it for, anywhere up to $400. That's a huge profit.
But we don't know what that price is because there's no transparency and nobody will talk about it. It really is incredible. Yep. So you're going back to the protest this year. You're going to the protest in Indianapolis. What do you hope people take away from that protest? What do you hope happens?
I hope that the insulin makers realize that we're not going away. We're not going to stop fighting for what's right. We're going to continue to fight for the lives of the type 1 diabetics, that something needs to be done. Laws need to be in place. Big Pharma has been allowed to police themselves for far too long. The greed has gotten to be so extensive that it just makes me ill. You look at their financials and you see what their profits are per year, and you see what they spend on marketing, and you see what they spend on lobbying. And you realize all those dollars that they make, and yet there's still people out here dying because they can't afford it. It's so frustrating, and it's not right. And we're not going to stop fighting until there's an end to this.
What's the reaction been to you as you've been telling your story? Have people been shocked by this? Have people outside the diabetes community? Do you think the eyes are opening finally?
I think eyes are opening, but yet when people hear my story, they are absolutely stunned. I think if you have, insurance, especially through your employer, and you don't have, this huge deductible, you don't understand what it's like for people who are forced into these really crappy insurance programs, or the people that don't have insurance. If you don't understand how the affordability issue or the medications or the out-of-pocket expenses can be true, like if you're not experiencing it, it doesn't happen. And so I think when people hear Alec's story, they realize that really bad things are happening to really good people out here because of our healthcare system in the United States. And I think people are really getting, pissed off at our government for allowing this to happen.
I've definitely seen more talk over the last couple of years than I have since joining the community almost 12 years ago. And I'll just share a quick story from our side. We have great insurance. We've been very fortunate for that. But I did give, as many of us in the community do, I gave some insulin to somebody who needed it, a young adult actually who had a gap in insurance. And then it turned out that we were going to come up short. So I went to my pharmacy and said, hey, I need an extra vial. And it's usually like $25, I want to say. And she rang it up and it was $300. And I had never, as you said, I had never experienced that. We've had great insurance. We've never had to worry about the cost. And I've known the pharmacist since we've been diagnosed. I say we, but, it was my son, obviously. Known her for more than a decade. And she was able to do some magic and make it a vacation emergency. I'm not quite sure what she did and got it covered. But she said, I can only do this once, maybe twice a year. And then I was stunned. I mean, $300 a vial, that was insane. And as you say, I think it's almost a random number. If someone else with similar insurance, it might have been $400. It might have been $275. It didn't seem to really correlate to anything.
And that's what Alec used to say, too. It's like 1 month he would go to the pharmacy and he would buy the same thing every single month. The same box of lancets and the same box of needles and the same box of test strips and the same amount of insulin. And 1 month it would be $250. The next month it'd be $325. The next month it would be, $300. It's like, why is it never consistent?
Yeah. What do you think Alec would make of what you are doing? I mean, he would be so proud of you, but not knowing his personality, what would he be thinking?
I think he would be unfortunately, I think he would be really embarrassed. And I think that he would be, unfortunately, I think he would be upset that his name and his face has gotten so much notoriety. But I think he would be pleased to know that it's helping other people. Alec was kind of in some ways he was an introvert and he never really wanted any attention on himself. He was a very proud and independent and hardworking young man. And I often, wondered if he ever thought about quitting his job and just, utilizing, the assistance of the state for people who have no income, But I know that he would have never done that just because, of the type of person that he is. And so many people have said, well, he should have quit his job. He should have went on public assistance or medical assistance or whatever. And he wouldn't have had to pay anything and he'd still be alive. And it's like, he wouldn't have wanted to live like that. He was hardworking and independent and just wanted to, he wanted to, live his life, and he wanted, he loved life. He was so active, and he loved the outdoors, and he loved to travel, and he wouldn't have wanted to be, somebody's charity case. And I'm sure that's why he didn't come to me and ask for help, because I probably would have been like, you know what, it's time to move home.
Oh, sure.
And I know he didn't want to do that.
The other thing, and I'm asking this kind of to confirm it too, is this seems like it happened awfully fast, right? Mm-hmm. It was only a month. It wasn't as though he was stretching this out.
It wasn't even a full month.
Right. So to me, that's not a very long time at all, especially for someone to make a decision or figure something out. A month is really not long enough to think, well, maybe I should quit my job and go on public assistance, or maybe I should be finding other options. I just want to reiterate, it was only a month.
Yeah. So, June 1st, he officially had no insurance. He was found dead on June 27th. So he lasted 27 days without my insurance. And, a lot of people criticize me. I've read a lot of really nasty comments on social media about how I should take responsibility, how I'm probably guilty for my son's death, because I didn't give him the money. Honestly, I didn't know he needed it. He didn't come to me and ask me for help. I saw him 7 days before he was found dead, and he looked perfectly healthy. He looked fine. He stopped at my home. We chatted. He paid me his car insurance and was heading to Wisconsin with some of his buddies to buy fireworks for the 4th of July. He looked perfectly fine, and I asked him at that time, 7 days before he was found dead, is everything going okay? How's your blood sugars going? Have you been to the pharmacy yet? And he, I think, went to the pharmacy the very next day. But no, I never received that call for help. He didn't even reach out to his girlfriend and ask for, help to pay for his insulin. And I think he probably would have went to her first. But yeah, he didn't ask anybody.
Well, Nicole, I'm so sorry you had to go through any of that criticism and those comments. And, people can be awful, but people can also be very supportive, I would imagine.
Yes.
And
that's the majority of it.
Well, and that's okay. It's okay to acknowledge the people that are critical out there, because we've seen that. And we've seen a lot with diabetes that, people with diabetes need to just take better care of themselves. There's so much misinformation out there. And I think that's one of the big reasons why this doesn't get enough attention. But let's leave it at this. What are your hopes? What do you hope happens I asked about the protest, but as we share this story, as people listen, what do you want them to take away from this?
Absolutely I want people to know that type 1 diabetics did nothing to cause this diagnosis. It's an autoimmune disease. It's not because they eat at McDonald's or drink Coke or drink beer or smoke cigarettes. They did nothing at all to cause this. They can't do anything to prevent it, and currently there's no cure for it. Ultimately, I would love to see this autoimmune disease cured, but until then, what I would like to see is our government step up and place the lives of us ahead of profits, set laws in place for transparency, against price gouging, allow for generic formulas to be created. Ultimately, we want insulin to be affordable and accessible for all. We want people to know that there are advocacy groups out here that are advocating for those issues. T1 International is a great organization, and I work closely with them. Unfortunately, there are some advocacy groups out there that, take a lot of money from big pharma. So I try to distance myself from those organizations because I would really, I want to see, the grassroots advocacy groups that are working so hard and not taking any big pharma funding. Those are the people that have the best interest for diabetics at heart, and those are the people that I feel like are doing the most work right now for getting these laws in place.
At this point, looking back, anything from the year that stands out? You've done so many interviews and you've talked to a lot of people. Do you feel like we're making progress?
I definitely feel like we're making progress. From what I read online and what I hear from other people in the diabetic online community, the past 14, 15 months, the issue has just really taken off. It's really gotten a lot of publicity. And I think we're really getting to reach a lot more people with the ability to help us to make changes.
Well, Nicole, thank you so much for sharing your story. We will be linking up information to T1 International and to the protest, and we will be looking for you at that protest in front of Eli Lilly. And I hope you can come back on and share more of your story as time goes on. I'm so sorry about what happened, and your family has our utmost sympathy. But I cannot tell you how much I appreciate you getting out there and telling this story and educating people. It's making such a big difference. Nicole, thank you so much.
Thank you.
You're listening to Diabetes Connections with Stacey Sims.
It's hard to know what to say after something like that. I'm indebted to her, to sharing her story and continuing to speak out for our community. And if like me, you're left with that feeling of, well, what can I do? I would urge you to click on the links in the show notes, head over to T1 International, find out more, not just about their in-person protest. Maybe that's not your thing, but if you want to be better educated, they have a lot of research they've already done. And there are many ways that you can get involved. Personally, I think this is going to be changed at the state level, state by state. We've already seen some legislation that is pushing for more transparency, and I think we'll get more public opinion going that way. But it does have to change at the federal level as well. Let me know what you think. You can always email me, Stacey at diabetes-connections.com. As I said, kind of tough to listen to, very difficult story. But I'm glad that you did listen to it, and I really appreciate you being here. I'm Stacey Sims, and I'll see you back here on Tuesday for our regularly scheduled episodes.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.